So what's happening in healthcare today is really, really challenging. And the operative word that I would use is consolidation. So what is consolidation? Well, consolidation takes many, many forms. A great example of consolidation is the merger between Aetna and CVS. Those two large organizations found economies of scale, found ways to be more efficient, more profitable by merging together. They also create vertical integration, so everything from the supply chain of drugs all the way to the payment for those drugs is completely vertically integrated. So there's competitive advantages in large organizations consolidating. Consolidation can also occur when large practices come together and merge to create an even larger organization. Consolidation can occur when a state chiropractic association says, you know what, we want to create an independent physician network of our own, and then go to the payers and work with the payers on driving greater reimbursement by creating greater value for the system. So those are some really good examples of consolidation. So consolidation in healthcare, both challenges and opportunities. The challenges that we face are from larger organizations like large payers, insurance companies, and large corporations that create lots of competition and downward pricing pressure on individual providers. However, opportunity exists. We know that models exist to create a consolidated effort, a consolidated organization that have shown to be very, very successful. State association-owned independent physician networks, clinically integrated networks, and private practices that consolidate in order to create leverage, improve outcomes, improve operational efficiencies, and improve overall provider satisfaction. We know that, at least in our region here in the Mid-Atlantic, we know that these reimbursement rates are not going up, and in fact, our reimbursements have been cut. And yet the price to run a practice has continued to rise. So one way to fight that particular issue, again, is for consolidation of private practices. Now, this is different than, let's say, a clinically integrated network or a state association to an independent physician network, because consolidation of a private practice means you're literally one company. So why would that benefit the individual provider? Well, first, it will benefit the individual provider because as the organization gets larger and larger, they have more negotiating power and leverage with the payer. If you've got 2 practices, there's no power. If you've got 200 practices, there's a tremendous amount of power in being able to negotiate with the payer because you're treating more of the populations that they serve. So an important opportunity for doctors of chiropractic as it relates to consolidation also allows them to be somewhat free of the day-to-day responsibilities of running their own practices. You know, anybody who's been in practice and owns their own practice knows that they wear multiple hats. They're the leader of the team, they're a manager, they're the technician, they're the doctor who's taking care of patients, they're the person who's scrubbing the toilets at the end of the night. And they're literally doing everything and anything that needs to be done in order for the practice to be run. But being in a larger organization has tremendous advantages. And one of those advantages is not being responsible for the day-to-day operations of the organization as a whole, not being responsible for HR, not being responsible for finance, not being responsible for marketing. These are great opportunities for the clinician or the doctor to focus purely on patient care, which is really why many of us went to school. So being able to be in a larger organization that allows for doctors to do what they do best, to do what they enjoy the most, to really leverage their unique ability is a huge advantage and opportunity for doctors to join larger organizations.